Hello, hello, all, and welcome to the L Show, where the L stands for leaning in, which means we will not shy away from any subject, no matter how taboo or uncomfortable. Things like menopause, sex and libido, menopause, dry vagina, hot flashes, mental health, and depression, which makes you not want to have sex, how we look, and how we feel. Um, this is what this show is about. I am your host, Dr. Nicole Eastman, and am the owner of Rose Pharmacy and Boutique Apothecary, located here in beautiful Cornelius. We are a compounding pharmacy with a focus on functional medicine and a much more natural approach to your health. And for those of you who are not familiar with what compounding is where your pharmacist makes medications that are formulated in a specific dose and or in a specific dosage form that is unique to you. Not all compounds or compounding facilities are alike, and quality shows in every aspect of what we do. And if you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, well, look no more. Rose Pharmacy is the place for you, where quality shows in every aspect of what we do. If you, again, need any assistance with taking medications, kind of understanding how you should be getting dosed, if you've been taking supplements, you feel like you're taking maybe too many supplements, or both, make sure that you take advantage of our consultation services where we can help you safely work on solving those issues. And gut regimen for the new year. Remember that everything begins and ends with a healthy gut. The effectiveness of any therapy that you may be on is linked to how well your gut is performing. So take advantage of a few of our gut bundles at Rose Pharmacy to help you get and stay on track throughout this year. With Rose, there is a guarantee of what is in each bottle, and for very few companies can actually offer you that. And also considering the time of year, make sure that you pick up a bottle of Sweet's elderberry syrup, which is just what we need to help our immune systems during this time. This episode has been pre-recorded, so although you may not be able to interact with us, you can still call the studio with questions to be answered on our next show at 844-STUDIO-4, or you can also comment on social media. And as always, I encourage you to check out our website at www.roserxboutique.com or Instagram and Facebook at Rose Pharmacy and Boutique Apothecary. OMG, guys, I am excited to share some news with you all about THC. THC. Now, for some folks, it may not move that needle, but because I believe in and I sell hemp-based THC and CBD products, it's important that I keep you all informed of what's going on because it does impact access. It impacts our business. So I want to first, though, make a distinction with regards to cannabis. So the cannabis plant that has less than 0.3% THC is the hemp plant. The cannabis plant that has greater than 0.3% THC is called the marijuana plant. Now, you can get CBD and THC from both of those plants. And the reason why I can sell THC products legally is because it is from the hemp plant, which is legal in all 50 states as defined by the 2018 Farm Bill. So we've got that out of the way, okay? So the news that I want to share with you all is around that marijuana plant, the plant that has greater than the 0.3% THC. So the Department of Health and Human Services recommended in August 2023 that the DEA, that's the Drug Enforcement Agency, change marijuana's classification from a Schedule 1 drug to a Schedule 3. So the reasons, though, I mean, it's August, they did this in August 2023, and we're just finding out about it. The reason why we're just finding out about it is because of this attorney by the name of Matt Zorn. He's in Texas. He successfully sued the DHHS, the Department of Health and Human Services, for the release of documents, and that happened about a week and a half ago under the Freedom of Information Act. So we got information on what was in that document, and it was shared. So I think what you need to know first is one thing. So the DEA is the one who places all controlled substances into certain schedules. So there's a Schedule 1 drug that is where you have the highest potential for abuse and no accepted medical use. So things like heroin, LSD, ecstasy, marijuana is currently in that schedule. Then you have Schedule 2, which also have a high potential for abuse, but it has accepted medicinal use in the United States. So things like cocaine, opium, high grade morphine, oxycodone, methamphetamine, i.e., the Adderall, the Vyvanse, the Ritalin that is prescribed all day, every day, is in a Schedule 2 class. Then there's Schedule 3. And Schedule 3, it has less potential for abuse than Schedule 1 or 2, but the abuse can lead to moderate physical or psychological dependence. And so it also has accepted medical use. So we think about things like anabolic steroids, so your testosterone, things like codeine mixtures, ketamine. So those are drugs that are in Schedule 3 and then Schedule 4 and Schedule 5. So Schedule 4 will be things like your Valiums, your Ambien, Zolpidem, those sorts of things. But I think it's interesting that for the first time, the Department of Health and Human Services has publicly acknowledged marijuana's medical use by making that recommendation of moving it from a Schedule 1 that has no accepted medical use to a Schedule 3 that has accepted medical use. Marijuana is currently legal for medicinal purposes in about 38 states and the District of Columbia. And in the analysis that was conducted by the FDA, officials determined that marijuana is less harmful than other drugs, citing that overdoses from like opioids and whatnot are killing people at rates much higher, 100,000 deaths a year, more than that. And so this is the quote. Although the abuse of marijuana produces clear evidence of harmful consequences, including substance use disorder, they are relatively less common. Hear that again. They are less common and less harmful than some other comparator drugs. Officials said dependence is relatively mild for individuals, but of course can lead to more severe dependence with increased exposure. So, this is major. This is major. And my plan is to make sure that I keep you all informed in the area of THC changes as things come down the pipe about this, because this can be a game changer with regards to access. So again, I will keep you guys informed with what's going on, especially considering I do sell the hemp-based product, but when we're thinking about getting it legalized for medical marijuana legalization, this is where this falls in. It's just going to be an amazing thing. So since we are starting the new year off on the right foot, a very important piece of that is making sure that we are getting the right medical exams, procedures, and labs done now so that we can know how to navigate the rest of our year. And I'm happy to let you know that we have joining us via WebEx Dr. Eva Imperial, who is not only a board certified family medicine physician, but she is also the owner of iHLTH, a lab company. So she is perfectly positioned to help navigate what we need to do. And remember, if we don't know where we are currently, how will we know where we're going to go and how we're going to get there? So on the other side of the break, Dr. Imperial is going to help us get where we are going. And if you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more. Rose Pharmacy is the place for you. Quality shows in every aspect of what we do. And do you feel like you may be taking too many medications, ineffective supplements, or both? Make sure that you take advantage of our consultation services where we can help you safely work on solving that issue. And your gut regimen for the new year, remember that everything begins and ends with a healthy gut. The effectiveness of any therapy that you may be on is linked to how well your gut is performing. So take advantage of a few of our gut bundles at Rose. And remember, there's a guarantee of what is in every bottle, and very few companies can offer you that. And remember, this episode is being pre-recorded, so although you may not be able to interact with us, you can still call the studio with questions that can be answered on our next show at 844-STUDIO-4, or you can comment on social media. We'll be right back with our guest, Dr. Eva Imperial. Hello, all, and welcome back to the L Show. I am your host, Dr. Nicole Eastman. If you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more. Rose Pharmacy is the place for you. Quality shows in every aspect of what we do. And do you feel like you are taking too many medications, ineffective supplements, or both? Make sure that you take advantage of our consultation services where we can help you safely work on solving that issue. And gut regimen for the new year. Remember that everything begins and ends with a healthy gut. The effectiveness of any therapy that you may be on is linked to how well your gut is performing. So take advantage of a few of our gut bundles at Rose Pharmacy to help you get and stay on track throughout this year. With Rose, there is a guarantee of what is in every bottle, and very few companies can offer you that. And also, considering the time of the year, make sure to pick up a bottle of Sweets elderberry syrup where it is going to help that immune system stay good. And this episode is being pre recorded, so although you may not be able to interact with us, you can still call the studio with questions to be answered on our next show at 844 Studio 4, or you can also always comment on social media. So we have with us Dr. Eva Imperial. She is the founder and CEO of iHealth. Dr. Imperial, she obtained both her undergraduate and MD degree from the real Carolina. That is the University of South Carolina. Okay, that's the real one. Okay, make sure everybody knows this. Go Cox. With over 2 decades of experience and is a passionate professional. She is all about making healthcare accessible and affordable to everyone. Welcome to the show. Welcome to the show, Dr. Imperial. Thank you for being here.
Thanks for having me.
Absolutely. So, I want you to first give us a little bit of your background and how you decided that you wanted to open up a lab company.
Hi, thanks for having me. I am Dr. Eva Imperial. I am the CEO and founder of iHealth, which is a lab company. I started this because it was clear that healthcare was becoming very expensive for my patients and access was difficult. So, creating this lab company helped provide nationwide lab services to people who needed their labs or people who were underinsured or had high deductibles. And we made it super easy where you go online, order your labs, you get the order in your box, in your email box, and then you can go directly to the lab. We have 10,000 sites all over the country that you can access, and then we release the labs. And
Okay.
it's transparent pricing, it's cheaper than using your insurance oftentimes for some of the vitamin levels and hormone levels. And I just wanted to make sure that everyone had equal access to either a lab or home kits to get your numbers, to know your numbers.
Okay, wonderful. And we will definitely go into detail about that on in our last segment. But right now I think I want to just query you because you are board certified in family medicine. And so
Mm-hmm.
for all of those that are listening, and I'm telling you, okay, so you haven't been to the doctor in a long time, like you're busy with your family, your work. I mean, you yourself are a mom of two amazing daughters who keep you busy with competitive dance. So, like, where do I start?
That's a great question. The place to start is to have a primary care doctor, to have what we call a medical home where you can develop a relationship with a physician or a mid level provider that will get to know you. So you've got to find someone that you're comfortable with, and that's shopping. So you can get recommendations from friends, neighbors, and then go try it out because what may work for your neighbor may not be what you need. So I encourage you to get out there, find a primary care doctor, get established. It's like finding a hairdresser that you may not find the right one on the first try, but it's okay. There are lots of different styles, lots of different types of practices, but find one who can get to know you so that you can be as healthy and not wait until you're sick to access a doctor.
What labs should we be getting, and how often like should we be getting those labs?
That's a great question. So it's important to get an annual exam. And the most common labs that are ordered to get a baseline would be what we call the annual wellness panel on iHealth. But that consists of a CBC, which is a complete metabolic, excuse me, a CBC, which is a complete blood count that checks for hemoglobin and a few other markers in your blood. A CMP, which is a comprehensive metabolic panel. It checks liver function, kidney function, your glucose level, and some electrolytes. And then lipids, which is your cholesterol, the good cholesterol, the bad cholesterol, the triglycerides, which are the fatty globules in your blood. And then the last one is probably my most favorite, and it's the thyroid, the TSH, which gives us an idea, a number of what your thyroid level is functioning at. If the thyroid's not right, nothing's right. So these are lab panels that you should get every year to monitor your health. If you're a male, then you should also get a PSA added to that on your annual, and it depends on your risk factors as to what age that starts.
So
But if you get that every year, that's a good baseline start.
so then okay, so following this baseline, what labs should we then be getting, or what exam should we then be getting following this baseline?
So the baseline labs are great. If they're all normal, then you just go every year. If they're abnormal, that may trigger your provider to get more labs. So let's say you're anemic, and then again, that's why you have to have an annual exam to screen these things. If you're anemic, then you may end up getting a colonoscopy. You may end up having heavy periods and need to have more details about that. Or you may be hormonal and need to get hormone testing. So get an annual visit to establish with your primary care doctor. Get those labs. If the place that you're going to is expensive, you can use iHealth to get those labs, and then get the regular screening tests based on your age.
So, okay, I went to the doctor and okay, so as medical professionals, I think we're the worst, right? We're the worst ones. But I went to the doctor and, she's looking at my chart and she's like, okay, wait, you need to get this done. You're overdue. I mean, I was overdue for everything. I'm like, whoa, okay. So she said the one that I the most nervous about is a colonoscopy. So we only have a few more minutes in this segment, but we'll start talking about it and then we'll continue, into the next segment. But tell me about the colonoscopy. So she says I'm overdue. I'm almost 50. But tell me about so what's the normal? When should I have gotten a colonoscopy?
So you're late for your colonoscopy screening because they changed the recommendation. It used to be at age 50, get your colonoscopy. I know people dread it
Okay.
because they dread the prep. So now the new recommendation is 45. At age 45, if you have no family history, you're low risk, 45, you should get a colonoscopy. If you can't get the colonoscopy or you're afraid, there are other options. You can get a home stool kit. There are several on the market. We also have it on the iHelp website as well, where you collect the sample at home, mail it to the lab. So you have options if you're not ready to get the full colonoscopy, although colonoscopy is going to be your gold standard. So you're technically late because the recommendations change, but I'm so happy that you went to the doctor because we
Yay!
make the worst patients. So
Yeah.
that's awesome.
So
Got to start somewhere.
with that alternative though, tell me really quickly. So what is that? What's the alternative? What is it
It
looking for?
So it is looking for blood in the stool that is not seen with the naked eye. So meaning that you're going to put you're going to get a kit at home delivered to your door. You will put a stool sample in the kit, mail it to the lab. With they're looking for blood that can't be seen with the naked eye because that could indicate that you have polyps. Worst case scenario is it's indicating cancer. So when we get that screening test, it's a screening test. And if it's abnormal, meaning you have blood in your stool, then your doctor will then refer you to a GI doctor or to a surgeon to get a colonoscopy.
Wow, that just, I like the alternative of doing it at home versus the prep, but of course, if they see something, then you have to still go ahead and do it. So maybe I should just go ahead and, well, I hope my doctor's not listening. I'm gonna do it. I promise I'm gonna do it. Um, and when we get back, I want to talk about, if you have a history of colon cancer in your family. Okay, just when we get back from break. So if you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, well, look no more because Rose Pharmacy is the place for you. Quality shows in every aspect of what we do. And do you feel like you may be taking too many medications, ineffective supplements, or both? Make sure you are taking advantage of our consultation services where we can help you safely work on solving that issue. And the gut regimen for the new year. Remember that everything begins and ends with a healthy gut. And the effectiveness of any therapy that you may be on is linked to how well your gut is performing. So take advantage of a few of our gut bundles at Rose Pharmacy to help you get and stay on track throughout this year. And with Rose, there's a guarantee of what is in each bottle. And very few companies can offer you that. Also, considering the time of year, make sure that you pick up a bottle of Sweets elderberry syrup, and it's delicious, and it will definitely help to keep your immune system healthy. And remember that this episode is being pre-recorded, so although you may not be able to interact with us live, you can still call the studio with questions to be answered on our next show at 844 Studio 4, or you can comment on social media. We will see you on the other side of the break with Dr. Eva Imperial. Welcome back to the L Show. I'm your host, Dr. Nicole Eastman. If you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, well, look no more. Rose Pharmacy is the place for you, where quality shows in every aspect of what we do. And do you feel like you're taking too many medications, ineffective supplements, or both? Make sure you take advantage of our consultation services where we can help you safely work on solving that issue. And your gut regimen for the new year, remember that everything begins and ends with a healthy gut. And the effectiveness of any therapy that you may be on is linked to how well your gut is performing. So take advantage of a few of our gut bundles at Rose Pharmacy to help you get and stay on track throughout this year. And with Rose, there is a guarantee of what is in every bottle, and very few companies can offer you that. And also, considering the time of year, make sure you pick up a bottle of delicious Sweets elderberry syrup, just what we need to help our immune system. This episode has been pre recorded, so although you may not be able to interact with us live, you can still call the studio with questions to be answered on our next show at 844 Studio 4, or you can comment on social media. We are here with my guest, Dr. Eva Imperial. She is giving us the lowdown on the labs and exams and things that we need. And when we left off, we were talking about the dreaded colonoscopy. So, Dr. Imperial, if you have a history of colon cancer, when should you get a colonoscopy?
That is a great question because nobody wants to get the colonoscopy, but it is very important because this is your colon cancer screening test. So if you have a family history of colon cancer, someone in your family, blood related to you, has a history of colon cancer, the rule's a little bit different. Again, normal history, no family history, you don't have any issues, you're going to get your colonoscopy or a home kit to test for blood in the stool at age 45. If you have a family history, it's a little different. Let's say you have a relative or you're a parent who was diagnosed with colon cancer at age 47. Your screening is not at age 45. Your screening is take away 10 years. So at 37, family members that are blood related to the person who had a diagnosis of cancer at age 47, they will screen at 37,
Wow.
right? So that is important to know. And that's why, again, get your doctor that you're comfortable with so you can establish your history so they can get to know you because it's tailored medicine. It's not cookbook medicine. It has to be tailored to that person, just like the way that we tailor blood pressure medications or diabetic medicines based on your kidney function, liver function, your health. So, again, medicine is not cookbook, it is the art of medicine based on your history and based on what's needed.
So, talk to us about pap smears. At what age? What age should we be getting pap smears?
So the recommendations have also changed in the past couple of years for this as well. So I try to stay up to date to know what is the latest so I can provide that for my patients. So now the pap smear is a cervical cancer screening test just for cervical cancer. You should get that at age 21. And then the new recommendation is every 3 to 5 years based on your risk factor and based on your result of an HPV test, which is a test that's added on to see if you have it. And that again, it's a screening test for cervical cancer. It does not mean that you don't ever go for pelvic exams.
Okay, but
That
there's a
is
difference?
there is. So the pap smear is just swabbing, doing a swab of the cervix. And the pelvic exam, which is still important, I want my patients to go for their annual physical exam. That is where we're actually looking because you can have cancer in other parts of the body, including the vagina, including the vulva or the groin area as well. You can have polyps that can cause bleeding. Someone actually has to look and examine you with a pelvic exam, and also they're checking to see if they feel any masses on your ovaries or in your abdomen. So again, it's telehealth is great, Having home kits for tests is great, but you still need a physical exam to screen for other issues in your body.
So I hope everybody heard that, all our ladies out there, there is a difference between a pap smear and a pelvic exam. The pap smear, cervical cancer screen, the pelvic exam is where they're feeling inside to make sure that they don't feel anything abnormal. So what happens if you have an abnormal pap smear? What happens next?
So what should happen next is number one, I like to go over the basics. Don't expect your healthcare provider to they may have forgotten to call you. They may have tried to call you and didn't get you because everyone's voicemail's full. Make sure that you are going to be your own patient advocate. Don't assume that tests are just normal. Call the office if you haven't heard or access your portal. But if your PAP is normal, it does abnormal, it doesn't automatically mean that you have cancer. This is a screening test, which means more data is needed to see what you have. If you have an abnormal pap smear, a lot of the times you will end up getting another biopsy or getting a biopsy of your cervix. And it is, again, another test so that we can figure out what needs to happen next. The good news is that there is a vaccine for HPV, which a lot of the kids are getting to help prevent getting cervical cancer. It's crazy to think that that a virus causes cancer, and it's the
Hmm.
HPV virus that causes cervical cancer. So that is why a vaccine exists to decrease that. Um, Worst case scenario, depending on if you haven't gone to the doctor a long time and they see something abnormal, then you may end up getting a hysterectomy to remove the abnormal cells of the cervix so they don't spread everywhere. I think I was telling Nicole about the first patient when I was an intern, the first patient that I ever took care of that passed away. She had not gone to the doctor in so long. I saw her in the ER because she had vaginal bleeding when she shouldn't have been bleeding at all because she was menopausal. So she came in, so she did the right thing. She went to the ER, probably the worst place to have to get a pelvic exam or a, they're not equipped for that. It's not
Hmm.
warm, friendly, and fuzzy when you're in the ER with a pelvic issue. Um, but when I did her exam, I could see the giant mass that ended up being cervical cancer because she had not accessed healthcare for whatever reason so long. So that was a tough one for me because cervical cancer and all these cancers are can be preventable or you can have options because you can screen for these things before they become problematic, before you have symptoms.
Wow, yeah, that's a very powerful story. I think we think about, okay, well, the likelihood of the prognosis being really bad, is less if you are keeping up with your screenings, keeping up with your exams. And when you just pop up and you're like, I haven't been in years, it may be too late to really be able to treat you appropriately, is basically what you're
Right.
saying.
And our
Mhm.
healthcare system is set up on, well, go to the urgent care when you're sick, go to the urgent care. That's why I try to encourage patients to get established with a practice because you may not need them today, but we can do preventative health care based on your age or risk factors and things like that. So Nicole,
Right.
we take care of everybody else, and we need to put ourselves first because other people rely on us.
Powerful words, powerful words. So, if you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more. Rose Pharmacy is the place for you. Do you feel like you may be taking too many medications, ineffective supplements? Make sure you take advantage of our consultation services where we can help you safely work on solving that issue. And take advantage of a few of Rose's gut bundles. Your gut is the baseline for everything that should be working in your body. So, take advantage. Your gut regimen for the new year. Remember that everything begins and ends with a healthy gut. The effectiveness of any therapy that you may be on is linked to how well your gut is performing. So take advantage of a few of our gut bundles at Rose Pharmacy to help you get and stay on track throughout this year. With Rose, there's a guarantee of what is in every bottle, and very few companies can offer you that. Also, considering the time of year that we are in, make sure that you pick up a bottle of Sweet's elderberry syrup. It's delicious, and it's just what we need to help our immune system stay on track. And this episode is being pre recorded, so although you may not be able to interact with us, you can still call the studio with questions to be answered on our next show at 1 844 Studio 4, or you can comment on social media. And we will be right back with the L Show, in which Dr. Imperial is going to talk with us about her lab company and what she offers. See you when we're back. We are back with the L Show. I am your host, Dr. Nicole Eastman. If you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more. Rose Pharmacy is the place for you. Quality shows in every aspect of what we do. And do you feel like you may be taking too many medications, ineffective supplements, or both? Well, make sure you take advantage of our consultation services where we can help you safely work on solving that issue. Your gut regimen for the new year. Remember that everything begins and ends with a healthy gut. The effectiveness of any therapy that you may be on is linked to how well your gut is performing. So take advantage of a few of our gut bundles at Rose Pharmacy to help you get and stay on track throughout this year. And with Rose, there is a guarantee of what is in each bottle. Also, considering the time of year we're in, where everybody is sick, suggest that you pick up a bottle of delicious Sweets elderberry syrup, and that's just what we need to help our immune system keep on fighting the day. And this episode is being pre recorded, so although you may not be able to interact with us live, you can still call the studio with questions to be answered on our next show at 844 Studio 4, or you can always comment on social media. Dr. Imperial, thank you so much for going over so completely what we need to do And good idea for me, right? What we need, what we need to do with regards to getting, our exams, screenings, labs, and with regards to labs, your company is the go-to. So we talked about it a little bit at the beginning, but now I want you to really delve into it. Tell us about iHealth and the full reason you decided to start this company.
So iHealth is my company that I'm the founder and CEO, and it's iHealth for your health. And it really is meant to provide access for home kits or labs. If you have no insurance, you're in between insurance because of jobs, or you have a high deductible, and insurance does not cover everything. So, what I wanted to do was create a company where patients nationwide can access labs. You can go to 10,000 patient service centers
Wow.
across the country and get your lab work done, get your urine test done, get your annual lab visits, get your vitamin levels or hormones done in a very easy manner that should be seamless and not frustrating um, in the process, and then get your results quickly. So my goal was to make it easier and less frustrating, because I think that everyone has probably had a lab experience that was not so great, or you went to go get your blood work done and it was a long wait time, or they said they didn't get the order. That happens all over the country every day.
Or it's not
And
covered, or it's not covered and you didn't know how much it was going to be and you end up paying $300 for yes.
right,
Clearly
right.
it's
And
happened
that
to
is
me.
part of the
You can feel that.
reason that I created the company, is because of the you it's like when you fly on an airline and you have to check your bag. What if they didn't tell you how much the bag was until 3 weeks later and you got a bill? Like, you need to check the bag, but we're not going to tell you until 3 weeks, and then there's nothing you can do because you're stuck paying that bill because of the transparency that doesn't happen in healthcare. That's healthcare. They're going to tell you exactly how much your bag's going to be, or when you check out at Target, you know exactly how much it is. Healthcare is not like that. iHealth is like that. People need to know how much they're going to pay for services.
So tell us about the customer experience. So what
The
if
customer
if
experience.
I need some labs, what do I do?
Right. So you go to our website, you go to iHealth.org, you order the labs that you need or that you want. We even have dermatology panels, we have vitamin levels. You order the lab, you place the order online. It's FSA and HSA approved as well, or you can put your credit card payment. We went through links to get the FSA and HSA approved. Um, Minutes later, you get I think it's actually seconds later, you get a receipt that you can submit to your FSA or HSA if needed. Uh, then you will get a lab order with instructions of exactly what to do step by step. And then you can make your appointment for your lab if you want to, or you can walk into over 10,000 different options across the country to get your blood work done, and you leave. You don't pay any extra charges or hidden fees when you order through us. And then 2 days later, you will get your copy of your lab results. And it's the same labs that your doctor or hospital may use, but you have access to it without having to track them down through a doctor's office. Very easy.
Yeah, that's very easy. So the next question though, Dr. Imperial, what if, okay, I go and I get some labs done and I see that something is amiss and I may not have a primary care or I can't get in to see them for 4 weeks.
Mhm.
What options do I have then?
You ask that like that's happened before or happened to one of your patients, or your customers
Yes,
at
yes.
at your place.
Mhm.
So we are also building a set of resources. So again, we're a lab. So we're not diagnosing, we're not treating, we're helping with one frustrating part of the healthcare system, but we are not going to leave you hanging. We have options that we can provide, that we have associated virtual practices that we can refer you to, that they can go over your lab work with you, and they're not super expensive. They're very reliable, board certified physicians and teams that are waiting to help because they believe in the quality of healthcare just like we do. So we're not going to leave you hanging. If you let's say you needed STD testing or you needed a vitamin level and now you're worried about it because your doctor can't get you in right away, they can get you in 3 weeks and you're going to Google
Mhm.
and worry. We don't want you to do that. We're going to provide a resource and options of reliable vetted affiliate partners that we can connect you with, and they can help you get treatment.
That's amazing. That's amazing that you make it so seamless, so transparent, so easy. The whole um, I say it's the whole supply chain with healthcare. You go in here, you come out there, can be a very frustrating experience for patients. And this, to me, any way we can make it easier for people, decrease that stress level, it's amazing. So,
Absolutely.
what about like for practice? I know that you also, of course, I know. So, tell me about the practice experience.
So that's a great question. Running a business is very difficult in healthcare because of all the other stresses and costs. So we have actually partnered with several medical practices that are either weight loss, hormone clinics, things like that, and we or procedural clinics or surgery centers to get those clinics cheaper pricing. So if, for instance, if you are a standalone private practice, direct primary care practice because you want the time with your patients, the labs are going to be very expensive when you contract with the labs. What we're able to do is because we have volume, I think we have practices that we help in 36 different states, that we're passing on those savings to them because I want the small business that believes in quality healthcare to survive through this healthcare um,
Mhm.
landscape right now. It's hard to run a business, and I want to pass on iHealth savings and our efficiencies and making it easier for their patients. I want them to mimic the same things that I wanted in my practice, that I want for my patients. And we did it with iHealth, with the business.
Where can our listeners and viewers learn more about eye health?
So iHealth is on Facebook and we are on Instagram. Our handle is at iHLTH underscore. And we also have a website, iHealth.org, iHLTH.org. Or you can call and leave a message, and it is 706 Labs Now. If you still have a home phone, landline, or you use the phone, a lot of our customers never talk to us. They may send us a text and say, "Thanks, got the results. This was awesome. See you in 3 months for my A1C." So
Awesome.
we're we you can also send us a message and we can direct you as to what tests you need. In fact, we've had people that said, "Hey, I'm looking for the new Alzheimer APOE test." We had a few people reach out to that. What we did was we got pricing and we put it on the website because the
Wonderful.
insurance did not cover it. So we helped them get it for cheaper.
Awesome. Thank you. Thank you so much for sharing that. And if you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more. Rose Pharmacy is the place for you. And if you are taking too many medications, ineffective supplements, or you think you may be, take advantage of our consultation services where we can help you safely work on solving that issue. Also, your gut regimen. Pay attention to your gut regimen. Take advantage of Rose Pharmacy's bundles, our gut bundles, where we can help you get and stay on track. And with Rose, there is a guarantee of what is in each bottle. Also, considering the time of year, make sure that you pick up a bottle of Sweets elderberry syrup where it's delicious and it also helps to heighten our immune system. A few upcoming announcements. In February, Rose Pharmacy is going to begin offering two different weight loss solutions. One of them being a special dosage form of generic Ozempic to prescribers and their patients, which is easy to take and much more affordable. And to learn more about these solutions, please call us at 704 255 6172. And I want to thank everyone who tuned into this week's segment of The L Show. I'm your host, Dr. Nicole Eastman. pharmacist and owner of Rose Pharmacy and Boutique Apothecary. And a huge thank you to my beautiful guest, Dr. Eva Imperial. And for those of you who missed any part of the show or any previous episodes, you can find them on WSSCnews.com, or you can watch by following them on Facebook. We are also on Apple Podcast and Spotify. Now, ladies, block off that 3 to 4 p.m. time slot every Friday for the Elle Show, because I want this to be our happy hour where we are wrapping up a busy week together on a very uplifting note. Thanks again to all of our listeners and viewers. Can't wait to spend this time again with you next week. Have a fun and safe weekend. Thank you, Dr. Imperial. Thank you for being here.
Thank you.